BursaMed is a new line of dressings from SAM Medical products specifically designed to help protect against and treat pressure ulcers, diabetic ulcers, and other wounds by reducing skin friction and shear forces. Over 1.5 million pressure ulcers and 5 million diabetic ulcers are treated annually, due in part to an aging population and a steady increase in diabetes. Treatment is time-consuming and expensive. Costs can often exceed $50,000 per patient treatment. BursaMed was designed to help prevent new ulcers and help reduce the healing time of existing ulcers by reducing shear and friction at the source, thereby minimizing trauma, pain, and further skin breakdown. Friction forces affect the epidermis by dragging or rubbing the epidermis back and forth. Shear forces are non-perpendicular forces that affect both the epidermis and the underlying dermal structures by distorting and stretching the underlying soft tissues at an angle. There are two types of BursaMed dressings: transparent BursaMed dressings and BursaMed HC with hydrocolloid dressings. The unique patented feature of the BursaMed line of dressings is its gliding dome. When force is applied to the skin, the central dome collapses and produces a gliding movement, effectively redirecting the pressure vector away from the area protected. This feature helps prevent skin breakdown, helps relieve pain, and helps protect newly formed tissue by minimizing mechanical skin trauma. BursaMed HC with hydrocolloid additionally absorbs fluid and maintains the optimal environment for moist wound healing, providing a cushioning interface with the wound. Pictured here is our 2.5 by 4 inch BursaMed dressing. As the finger rubs across the dressing, the dome collapses and redirects shear and friction forces, thus protecting the skin. The features and benefits of BursaMed dressings are many. They are easy to apply and hypoallergenic. They are transparent to allow visualization of the wound bed. They are ultra-thin so that the dressing does not roll up. They are perforated for breathability, allowing moisture and vapor transmission, and easy removal. Remember, this is the only dressing designed specifically to reduce shear and friction, to help prevent skin breakdown, help reduce pain, and help accelerate healing. BursaMed dressings are very easy to use. The sacro and heel dressings have a recessed notch to allow more coverage of the sacrococcygeal area and heel. In this demonstration, we will apply a 5 by 7 inch BursaMed dressing to a stage 1 pressure ulcer in the sacrococcygeal area. The first step is to clean and dry the area before applying the dressing. We will next remove the dressing from the package, then stretch the dressing slightly to expose the white paper backing. Center the dressing over the affected area. Carefully remove one side of the white paper backing and press the exposed adhesive onto the skin using a rolling motion. Please avoid touching the exposed adhesive and repeat this for the remaining side. Use care when applying clothing to prevent the dressing from catching. To remove the dressing, please apply a medical adhesive remover, mineral or baby oil, or other appropriate removal method to the perforated portion of the dressing for easy removal. In this demonstration, we will apply a 3 by 4 inch BursaMed dressing to a stage 1 pressure ulcer on the heel of a foot. The first step is to clean and dry the area before applying the dressing. We will next remove the dressing from the package, then stretch the dressing slightly to expose the white paper backing. Center the dressing over the affected area. Carefully remove one side of the white paper backing and press the exposed adhesive onto the skin using a rolling motion. Please avoid touching the exposed adhesive and repeat for the remaining side. Use care when applying clothing to prevent the dressing from catching. To remove the dressing, please apply a medical adhesive remover, mineral or baby oil, or other appropriate removal method to the perforated portion of the dressing for easy removal. For stage 1 pressure ulcers, BursaMed or BursaMed with hydrocolloid should be used. For stage 2 pressure ulcers, BursaMed with hydrocolloid is ideal to reduce shear and friction while absorbing fluid and minor exudates and maintaining an optimal environment for moist wound healing. The hydrocolloid is also a cushioning interface with the wound. For Stage 3 and Stage 4 pressure ulcers, BursaMed is ideal as a secondary dressing placed over a primary dressing to prevent shear and friction to the wound. Please note that in addition to treatment of pressure ulcers, BursaMed dressings can also be used on diabetic ulcers, skin graft donor sites, second-degree burns, and superficial wounds such as abrasions and blisters. Thank you for watching this video on the applications of BursaMed. More information about BursaMed, including research studies, clinical reports, fact sheets, and testimonials, can be found by visiting our website at BursaMedDressing.com. This video can also be viewed again at this site.